Welcome. I'm Dr. Gail Lowenstein. I'm here to interview Dr. Garry D'Brant. Dr. D'Brant did the most wonderful presentation at CAM Group a few months back. And he was so amazing that I've asked him to be the speaker once again at CAM Group. Let me tell you what CAM Group is. CAM, C-A-M, stands for Complementary and Alternative Medicine. This is a group I started back in 2002 for physicians and other healthcare professionals who had an interest in alternative and holistic medicine. Over the years, lay people have joined us, and at this point, everyone is welcome to attend. Dr. D'Brant is a chiropractor, but he also has other degrees. He is a naturopath and a social worker and a nutritionist. He's a diplomat of the Shanghai Research Institute of Acupuncture and has studied in China with Qigong healers. So Dr. D'Brant, you're going to be talking this time on liver detoxification.
Yes. Yeah.
Now, when I told someone that you were talking on liver detoxification, she thought that was for alcoholics.
Well, she's right to the extent that alcoholics could certainly use detoxification as well, but it's really for the general public that we're talking about. The liver is probably one of the most important organs to detoxify because it does at least 500 different things that we know of as of now. And our knowledge of the human body is certainly incomplete, and we'll probably find out it does a lot more. So the liver is one of those organs that we might call a linchpin. And anybody who's looking to gain more energy, gain more stamina and vitality in their lives, perhaps shed some of the excess weight that they've had on their bodies, be able to reclaim some of the lost vitality that seems to happen as we age. Those are people that would be well suited to doing the liver detoxification, along with people who have specific health conditions, autoimmune diseases, immune problems, allergies, typical things that we see here on Long Island in everyday life, very much so.
So for the person who considers him or herself healthy, is liver detoxification worthwhile for them?
Absolutely. There is no one that I know of that really doesn't benefit from detoxifying. There are so many toxins that we're exposed to now, and they are happening in larger and larger quantities and more insidiously, so that we're really, at this point, a sinking ship in regards to toxins. And if we do not do something to actually detoxify ourselves on a regular basis, what's happening is we're becoming the repository for all of those toxins. Particularly, toxins seem to have an affinity for fat cells, so we are storing a lot of them in our fat cells. And if you haven't noticed, and I'm sure you have, many people are overweight and going towards obesity. Now we're beginning to understand the connection not just between a calories in and a calories out approach, but a toxins in and toxins out approach to why people are becoming obese.
I have heard that some people are obese because they have toxins that are causing the obesity, and it's a vicious cycle that the toxins cause inflammation, and that contributes to obesity, and you lose weight, however, and the toxins that had been in the fat tissue then gets let out into the bloodstream, and sometimes the symptoms can even be worse.
Yeah, that is very true, I think, and especially if you're doing a detoxification, what I would call a trendy sort of chic detoxification, these new models of different things, from the cabbage soup, this one, the Kool-Aid, this one, the lemonade, that one. If they are not biochemically sound, if they do not take into account the pathways that our body uses to detoxify, and particularly, again, the liver, every organ has the capability to detoxify. The difference is that the liver does up to 60% of our body's detoxification work. In 2006, the Harvard Public School of Research put out a paper, and it was a paper identifying babies under 6 months old. From the study, they did it from 1980 on, and found out that the rate of obesity in babies less than 6 months old had gone up 73% since 1980. Now, if you think about that for a minute, babies who are under 6 months old are not asking their parents to go out to McDonald's. They're not asking to go get a Slurpee. They're getting fed either by breastfeeding, and they're getting fed by formula, and those things are relatively the same as they have been for quite some time. They're also, it's not a question of lack of exercise, because babies under 6-month-old don't really exercise in a formal way. So what really is the culprit here is another really incredible statistic. In another study, toxins were found to the tune of about 280 in placental blood in children that are newborns. And 215 of those toxins were found to be neurotoxins, toxins that affect the brain and the nervous system. So it's no wonder that we're dealing with things like ADD and ADHD. But if we're talking about a population that's under 6 months old, and they have no control over the toxins that are coming in vis-a-vis the mother's blood through the umbilical cord, then we're already setting those children up for a plethora of problems later on.
So you're also explaining not only why we have so much ADD, ADHD, but probably autism as well.
Absolutely. The entire spectrum disorder falls into this conundrum, and many other neurological conditions that may have their origins in as early as the child's conception.
So as a mother, we should be particularly careful that at the time of conception that we are in peak health, so that we don't pass on deleterious toxins to our baby.
Yes, and that itself is a course in terms of living.
Because it used to be, okay, don't smoke when you're pregnant. But I'm hearing you say smoking is just one toxin that we need to be concerned on, and we're living in such a toxic world that we need to be doing active detoxification, especially before we conceive.
Yes, this is what I said before. We're losing the battle in regards to toxins.
Why is society putting these harmful chemicals in our products?
Gosh, this is the time I wish I had a dollar sign painted right here. We could just flash the dollar sign. I think it's a question of politics and money.
Right.
And the fact that these are chemicals that supposedly are doing a job, but we would have to ask the same question about herbicides and pesticides and insecticides. We use more in this country than the rest of the world combined. And I always ask the question, do we have more bugs? Do we have more pests here in the United States? I mean, are we somehow different than everybody else? Or is it an economic stake in the way that we're doing our business? To me, the invention or the introduction of these kind of wholesale chemicals into our life has a much bigger issue to it than our safety or the quality of our food.
Well, I absolutely agree with that.
We mentioned autism and the spectrum disorders, and the amount of Ritalin and other drugs are going up astronomically. Again, we use more Ritalin here in the United States than the rest of the world combined. And I again think, is it just because we have all of these kids with autism or attention deficit or whatever we're using it for? I think not. I think there are things in terms of chemicals and chemical constituents, as well as drug therapies, that are actually contributing to the toxicity that we're experiencing and the lack of quality of life and the loss of that quality of life. We are living longer but getting sick earlier. To me, though, that is a criminal state of affairs for a nation as evolved and as technologically savvy as we are.
That's worth repeating. We're living longer but getting sick sooner.
Toxic load is getting greater, and the body is doing everything it can to adapt, and it's creating more enzyme pathways to do it.
Wow. That's fascinating. Let me repeat that so people are really getting that. Our bodies are adapting to handle all of the increased amounts of toxins that we are accumulating in our bodies.
That's right. We're doing as well as we can. That's where doing detoxification and liver detoxification come into play. Why not aid your body in doing detoxification instead of leaving it up to its own wherewithal to do it?
That was just fascinating. And I hope you can all join us at CAM Group when Dr. D'Brant will talk in depth about liver detoxification to enhance your health.